So let's turn our focus towards 2022. What's the big movement we should be watching for in 2022?
Sarah set me up for one of my two, which is ambient technologies, ambient listening technologies. Because how are we going to get the nurse to be able to hold the hand? How are we going to get the physician to maintain eye contact with the patient? We're not going to do it through the old data entry that we thought we needed for the EHRs. We're going to do it through ambient technologies, ambient monitoring technologies, and automated note creation. That's going to be key for the nurses and for the doctors. So that's one of my big things for next year. I think this is still a nascent area, but it's evolving very, very rapidly. The quality keeps getting better. Now I'm going to say within 2 years, I think we're going to have a viable ambient monitoring and note creation process that most primary care and inpatient settings will be able to support. The second one is we're going to be in the security race forever, but I think this coming year, it's going to be really important as we are coming, I hope, out of some of the pandemic focus and into the realization that we have all this stuff to clean up. I remember when I became a CIO in 2013, I asked my one executive director who was over infrastructure and security what he needed. He said, I need budget for security. And he said, we're getting killed. And I said, but we haven't had a breach. He says, yeah, but I can't keep up on the current budget. And what I ended up creating the analogy with my team was that we were in a race with the hackers, with the nefarious actors, and we were at risk of losing sight of them. It's not just that they're ahead of us. We were going to lose sight of them if we didn't start investing. And I think we're back there again, just because of how rapidly we had to roll things out. And I think we've got to get back to where at least we're within striking distance or visual distance of those nefarious actors. They're always going to be ahead of us in this race. If we think that we can get ahead of them, we're delusional. I think we have to think about how can we keep becoming aware more rapidly of what their next evolution is, because they're going to get more precise in the coming year. It's not going to be the throw the net wide and hope type attack. It's going to be the spear phishing, the better assessment in advance, knowing what your system, what your health system has to offer them, what the viable outcome from a monetary standpoint is, and then targeting the right individual. I think it's going to become much more precise in the coming year, and we're not ready to catch up with that yet.